I wanted to do an explanation of how I like to attack the little perioral lines that a lot of us get. Historically, we call them smokers' lines, but it's not necessarily from smoking. It can be from anything from just normal talking and facial animation to maybe drinking habitually through a straw. But a lot of people develop these stubborn little lines around the mouth. And then also, everything I'm kind of talking about today also proves true for anywhere. Like sometimes you can get these longitudinal rhytids or creases in your submalar area and just crepey skin. So my favorite two products to use for those superficial kind of crepey lines that you see, the first is going to be our collagen stimulating threads. Specifically, I love to use the R&ACT HAPCL screw threads. So these are a really unique thread. They're made of PCL, which is a really strong collagen elastin stimulator. So those little threads are going to sit in there, be dissolved by your body. These threads are tiny, about the size of a strand of hair, so you don't see them, you don't feel them. But when they are placed, they're going to stimulate your fibroblasts to produce collagen and elastin. But what makes these so unique is they are not only made of PCL, which is a really potent collagen elastin stimulator, they're coated with hyaluronic acid. So it's like you're getting a 2-for-1. They go in, stimulate collagen and elastin, but then they also hydrate, which also is a huge part of reversing wrinkles. So I just find the results from these are amazing. What you need to keep in mind with collagen stimulating threads, these are not lifting threads. These are very different. They're just little tiny, like the size of a tiny strand of hair. They go in, you don't see them, you don't feel them, and they work over the course of 10 weeks. So what you need to keep in mind, you don't get immediate gratification. It takes about 10 weeks to rebuild those collagen elastin stores. And often you'll see improvement, and it's very wise to do like a series of 3, like about a month apart, to really rebuild that collagen elastin foundation. So that's our HAPCL threads by an awesome company called R&ACT. Love that product for superficial perioral lines or any laxity anywhere. This product is amazing for those collagen stimulating threads. And then the other product that I love, if someone's able to afford both treatments at once, you just really get a wow result. For those little perioral lines is our HA Redensity. This is a super thin, stretchable, flexible HA filler. I've done a whole nother video on the RHA line and the reason I feel like it's the latest and best technology in HA fillers. But this is a really thin product, so I place it really superficially in those perioral or longitudinal lines, and it's not lumpy, it's not bumpy, it just meshes so beautifully with your tissue. One thing you may realize is that the area around your mouth is a super sensitive area. So what I typically do is I do what we call a dental block, where I place lidocaine on your mental as well as your infraorbital nerve bundles, and that provides profound numbness for the area, kind of like when you're at the dentist. That's my preference for numbing patients, is those injections rather than numbing cream. Numbing cream is great in other areas of the face, and if someone really doesn't want a dental block, we can always do numbing cream. I have a really strong, great numbing cream, but I still find that area, even with the best of the best numbing cream, is pretty sensitive. So in my opinion, it's just better to get you completely numb. Then I can work with you being comfortable, because typically the amount of threads I'm going to be putting in that area is like anywhere from 20 to 40, and then it's multiple little sticks to get the redensity in all the little lines. So as you can imagine, it's just a lot of sticks. I would much rather my patient just be completely numb and not feel it. In terms of recovery, there is typically some bruising and a little bit of swelling, but some bruising with this. So you need to be prepared. Bruises in the perioral area are usually a lot better in a week and completely gone in 2. So I always encourage my patients after the treatment to ice. I provide a little ice pack with a little strap on it, so you can just like strap it around the back of your head and be working at your computer, but icing is going to help that bruising be less, a little less bruising, and then it's going to help with the swelling. But you do need to expect some bruising. You can't walk away from a pretty intensive treatment like this and not have any bruising typically, because all of these are needle-based treatments. So hopefully that helps. Hopefully that all makes sense. There's always lots more information on our website, aestheticsconciergeoftexas.com, and then also on Instagram. Please follow us. We appreciate your support.